Hi everyone, today we are going to see about Crohn's disease. I am Brenda Ronika, tutor working at M College of Nursing. Objectives of this section is at the end of the class, students will be able to define Crohn's disease and list the types of Crohn's disease, enumerate the causes of Crohn's disease, discuss the pathophysiology of Crohn's disease, describe the signs and symptoms of Crohn's disease, and brief about medical and nursing management. Crohn's disease is a type of inflammatory bowel disease that causes chronic inflammation and irritation in the digestive tract. The inflammatory bowel disease contains two type of disease. One is a Crohn's, another one is a ulcerative colitis. So it can affect any part of the gastrointestinal tract from the mouth to the anus, but typically affects the lower part of the small intestine known as ileum. The cause of Crohn's disease is unknown and there is no cure. Therefore, treatment relies on medication. So, treat the acute inflammation and maintain a remission. Surgery is reserved for patients who are unresponsive to medication or who develop life-threatening complication. Next, what is Crohn's disease? It is a granulomatous inflammation of terminal ileum at adjoining colon. That is, granulomatous means that is a mass immune cells, so which will affect the ileum and the colon. So it will result in ulceration, stricturing means narrowing of the large intestine or small intestine, and it will cause fistula, that is abnormal connection, and abscess, pus formation. So this is about the definition of Crohn's disease. Crohn's disease is a granulomatous inflammation of terminal ileum and adjoining colon, resulting in ulceration, stricturing, fistula, and abscess formation. Next, types of Crohn's disease. According to the location, there are 5 types are there: ileal Crohn's, colonic Crohn's, ileocolonic Crohn's, upper GI Crohn's, and perianal Crohn's. First one is the ileal Crohn's, which means it affects the ileum, that is lower part of the small intestine. Next one is the colonic Crohn's, it affects the colon, large intestine. Next, ileocolonic Crohn's, that means affect both ileum and colon. And upper GA Crohn's means it affects the esophagus, stomach, and duodenum, upper part of the small intestine. And the last one is a perianal Crohn's, which affects the area around the anus. And according to the severity also types it is available, that is nothing but mild, moderate, and severe Crohn's disease. Next, we'll see about the causes and risk factors of Crohn's disease. The exact cause of Crohn's disease is unknown, but several factors contribute to its development. The first one is a family history and genetic predisposition, an abnormal immune response, that is means overactive immune response to normal bacteria. And the third one is the environmental factors such as smoking, stress, and even though certain medications also. And the last one is a imbalance of gut microbiome. Next, we'll move into the pathophysiology. So, how the disease is progressing, how it is occur. So, first one is the causative agent, that is the triggering events, environmental factors, and genetic predisposition, etc., which leads to dysregulated inflammatory and immune response in genetically susceptible person. So, what will happen means it causes the amplification of immune response. So, immediately which release some of the inflammatory mediators such as TNF, tumor nodular factor, and also some of the interleukins. So, these inflammatory mediators which causes the breakdown of mucus and continuous exposure to lumen dietary or bacterial antigen. These continuous exposure lead to impaired handling of microbial antigens by the immune system, finally which leads to the inflammation in the GI tract. This is about the pathophysiology of Crohn's disease. Next, we'll move into the clinical manifestation. So, one of the important signs and symptoms of Crohn's disease is diarrhea. The patient will have continuous diarrhea, and due to that, they'll feel the abdominal cramping pain, and this is an inflammatory disorder, so the patient will have intermittent fever, and due to diarrhea the patient will have weight loss, and sometimes along with diarrhea the patient have the symptom of rectal bleeding also. And the next one is a tenesmus. Tenesmus means it is nothing but it is a constant feeling that you have to go to the bathroom but you can't. And malabsorption, why means here the problem it is there in the small intestine, so the small intestine only doing the absorption process mostly, but here it will not properly absorb the nutritions, which leads to malabsorption, and also it could be ended up with a nutritional deficiency. So these are all the major signs and symptoms of Crohn's disease. Some of the other signs and symptoms are constipation, eye inflammation, fistulas, fissures, abscess, mouth ulcer. This is about the clinical manifestations. Next, diagnostic test. So the first one is a medical history. So we have to collect proper medical history from the patient about their family and genetic history, everything. And next important factor is physical examination. In that we have to do thorough head to foot assessment, and important thing is a abdominal examination. And next diagnostic tests are sigmoidoscopy and colonoscopy with biopsy, because the Crohn's disease sometimes it could be ended up with a cancer, so we have to better to do the biopsy also. And imaging tests like x-rays, CT scans and MRI scan, and we have to take a blood test to find out the inflammatory markers, and also this can cause anemia. For that also we need to take the blood test. And finally the important thing is a stool for occult blood and culture. Next, we'll move into the medical management. In that first one is the pharmacological interventions. Depends on the severity and extent of the disease, we have to administer drugs. That first one is the anti-inflammatory drugs such as mesalamine and sulfasalazine. So these drugs are recommended for both ulcerative colitis and chronic disease to achieving and maintaining a remission. And the second one is a cortisone or steroids. So the main example is a prednisone. It is used to achieve remission in inflammatory bowel disease, but are not effective for maintaining the remission. They are helpful for acute flare-ups, but are given for the shortest possible time because of side effect associated with long-term use. Next, immunosuppressants, that is azathioprine and 6-mercaptopurine. It is given orally and takes 3 to 6 months to exhibit full effectiveness. They are most useful for patients with chronic disease who do not respond to corticosteroids and other drugs. And the next one is antibiotics and antidiarrheal. So examples for antibiotics, metronidazole and Cipro and clarithromycin. And antidiarrheals also we have to administer. The common one is loperamide. And another one important thing is patient is having a continuous diarrhea, so fluid replacement, that is very important. So this is about the pharmacological management. Next, other medical management includes, first one is a diet. High protein, high calorie diet is given by oral or parenteral route. Low fat diet or milk free diet improves lactose deficiency or malabsorption. Low residual diet or high fiber diet is also supplemented to reduce colics, and also which causes a malabsorption, so we have to give supplementations like iron, folic acid, calcium, vitamin D, electrolytes, that whenever the deficiency occur. And the second one is a parenteral nutrition, that is total parenteral nutrition has been demonstrated to be effective in controlling the disease actively and complications of chronic disease for the patient. Finally, we have to provide the physical as well as emotional rest. This is about the medical management. Next, we'll move into the surgical management. So mainly these are all the surgical procedure which include for the Crohn's disease. First one is a resection of the affected area with anastomosis. That is, we have to remove the affected area and connect with the leftover part. And next one is a colectomy with ileostomy, and colectomy with ileorectal anastomosis, that is also depending on the area of bowel involved. So this is about the colectomy with ileostomy. The large intestine, that is the colon, it is removed and it is connected with the ileum. that is a part of the small intestine, that is called as a colectomy with ileostomy. And the next one is a colectomy with ileorectal anastomosis. Here also the large intestine colon, it is removed and it is anastomosed with ileum and rectum. So this is about the surgical management of the Crohn's disease. Next we'll move into the complications of Crohn's disease. So first one is the common complication, it is a malnutrition, because the small intestine, it will not absorb the nutrition, finally it be ended up with the malnutrition. And the next one is a intestinal obstruction, that it could be fatal, and it can form the fistulas. Fistula means you all know that is a abnormal connection here between the intestine and with other organs, and finally it can be develop the abscess, that is formation of pus. And the Crohn's disease also, it could increase the risk of colon cancer. And another complications are osteoporosis and arthritis. Why means this is because of the malabsorption of nutrients. These are all the some of the nursing diagnosis for Crohn's disease, that is diarrhea related to inflammatory bowel disease, impaired nutrition less than body requirement related to anorexia and malabsorption, fluid volume deficit related to anorexia, nausea and diarrhea, acute pain in abdomen related to increased peristalsis and cramping, impaired skin integrity related to frequent loose stools, and finally ineffective coping related to repeated episodes of diarrhea. So this is about the Crohn's disease. It's a chronic inflammatory disease of the digestive tract that can have a number of complications. There is no complete cure for the disease, and if it is worsens due to inappropriate or lack of medication, patient might be at serious risk of a small bowel or colon cancer. So as a nurse, we have to give proper health education to the patient, and we have to advise the patient to take medication properly. Thank you.